So our case study is on a patient named Matt. His age is 44, he's a male. He's 5'9", weighs 290 pounds, and he has a history of high BMI, about 47, hypertension, and type 2 diabetes. His family history is obesity and diabetes as well. So why should Matt get gastric bypass surgery? Matt's high body mass index impacts his ability to do basic everyday tasks, and his hypertension and type 2 diabetes puts him at serious risk of having a heart attack or stroke. Currently, Matt faces progressive diabetes, heart disease, and a shortening lifespan. Gastric bypass surgery offers a chance to regain mobility, improve health, and extend life expectancy.
The laser is in the middle,
Okay.
and the forward's on the right side.
Okay. So these are the 4 most known types of gastric bypass surgeries. The one we're talking about today is the gastric bypass, the Roux-en-Y gastric bypass. This is the most common. So the gastric sleeve, they cut a portion of the stomach and you're left with like a banana-sized stomach. So that way you get fuller faster, and then it follows the same route through the small intestine, starting at the duodenum. The one we're talking about, they cut off part of the stomach and it bypasses the rest of the stomach and the duodenum. And then you're left with like an egg-sized pouch, that way you also get fuller faster. But like the gastric juices still come out the same and then go through the duodenum and then through the small intestine. The gastric band, they put a band on the upper portion of the stomach. That way, again, you're fuller faster, you eat less food. And then it follows the same route through the small intestine. And then the last one is the intragastric balloon. They have like a water-filled balloon inside the stomach. So again, you get fuller faster, you eat less, and then it follows the same route through the small intestine.
Okay, and then how is the procedure executed? The patient is placed under general anesthesia and is carried by a team of people. Several small incisions are made, and they place a laparoscope inside the abdomen, and then so they can see inside the abdomen. The stomach is then divided to create a smaller upper pouch about the size of an egg, limiting food intake. The jejunum is attached to the new pouch, bypassing the duodenum to reduce absorption. The remaining intestine is rejoined so digestive enzymes and bile can still mix with food. Food now travels from the small stomach pouch straight into the middle section of the small intestine. Then it mixes with digestive juices lower down. And then all of the connections for leaking and bleeding are checked. Make sure that nothing's still bleeding. And then instruments are removed, incisions are closed, and patient is taken to recovery.
So the general facts, so where is this performed? This is performed in the hospital setting by a bariatric surgeon along with the surgical team and an anesthesiologist. The surgery lasts about 2 to 4 hours, but the patient will stay post-op about like a couple days to make sure there's no post-op complications. The recovery time is about 3 to 5 weeks total to heal from the surgery, and the patient will typically be on a liquid diet for a couple of weeks. The goal is to restrict food and calorie intake, that way it helps them lose weight. And the results, so like most patients will lose about 60 to 80% of excess weight, and that further helps them improve the like high blood pressure and the diabetes, which in this case, our case study, the patient did have diabetes and high blood pressure.
These are sources.
Interesting. Questions?
Is it something that can be reversed?
I know it can be stretched to get big again, the stomach actually itself, but I don't know if it can be reversed.
Yeah, because when we were like researching, it said like, or we were also talking with Heather, like if the patient doesn't change their eating habits and they're still eating in excess, their stomach can like stretch and like the whole surgery just is waste.
What are like some of the risks that come from that surgery?
There's a lot.
There's a lot.
Yeah, if you just think of any typical surgery, going under itself is a risk. Yeah, there's
after the surgery, if the sutures aren't sutured properly, sometimes those can come undone and you have to get into emergency surgery because they're all leaky.
There could also be like post-op like absorption issues. So that I don't know. I didn't go too deep into that, but I know that they have absorption issues after the fact, and they could go in and have to correct it somehow. I'm not sure how that would be
I
done.
can imagine there'd be issues with absorption, particularly since the region that they've chosen to preserve is the cardia, which is really just this small section of the whole stomach, and the rest of the stomach was responsible for absorbing, remember, sodium and chloride and things like aspirin. So what happens with aspirin absorption? Is that possible? That's a big question. What do you do with materials that would be absorbed in the stomach, like alcohol
Yeah.
and wine? What about that?
It did mention that less nutrients are absorbed, so
Yeah.
that's a big problem.
Yeah.
That would be a big problem. And, any other questions?
Is there a reason why they choose one type over another? Are there like, why is the Y
The root and
one most common? It seems like it's the weirdest.
It's like the most extreme, I almost think, because it's the
Oh.
smallest like amount of stomach. Because the other one, what was the?
So
The
yeah,
banana.
like
The banana
like
shape
that
one?
banana one with the Ruinex, pretty much that one really helps to shrink the stomach as best as it can. Even with the gastric band, you're still gonna have contents of food kind of going past the band. So shortening or making the stomach as small as possible is gonna help the patient just not have. It's gonna help them feel more full faster.
Yeah,
kind of thing.
super fast. Yeah.
But you could see how this one would be your most effective for quick weight loss.
Yes.
And this one, you could easily stretch that stomach out again.
Yeah.
Sure.
So if you don't have your dietary and eating habits under control, you eat the same way, you still don't exercise, you don't get your full.
But what about that lower sphincter and the pancreatic juices and the things that neutralize the hydrochloric
You're talking about this
acid?
one?
Yeah.
Yeah, this one is
nonsense.
really extreme.
Yeah.
And so
Yeah.
I'm like, so where's then the pancreatic juices coming in? How does it
They
like the
join
chyme
here.
So they're
like
coming in here.
Yeah.
Yeah, it still
that
comes
one
out
is
as
here.
still
Yeah, it's still
it's
in there.
still
it's
in there.
there,
Never-
and then it just
still-
goes a little
Yeah.
further.
So it takes a little longer for it to hit the chyme.
So do they make a new sphincter down there, like, or it's
No,
up there? Do
there's-
they
it's
like
still-
let
where
it-
does the top
They
of
don't
this-
need the sphincter because
So it goes into the
the
stomach.
sphincter is, here's your pancreas under here, your liver up there.
Yeah.
They're still delivering.
Yeah.
But no food.
No
So
food
this,
will go there.
the
Yeah.
sphincter here is still totally functioning.
But there's no food in that one.
No.
There's still a lower esophageal sphincter.
Oh, it's,
Yeah, yeah, yeah.
Yeah, it's. I thought they took the stomach out, but they don't take the stomach out. It's just
They just leave it.
Yeah.
Yeah.
And it probably shrivels up a little bit.
Yeah.
This one, I know people that have stretched the gastric band.
Yeah.
Oh, really?
I feel like the balloon and the band are the easiest to.
Yes.
To kind of,
And this one too, you could remove that band easily. I mean, that balloon easily.
Yeah, it could also.
Right, that'd be another
One that
endoscopic.
time into the duodenum.
If it gets
Do I
too
have to
small,
have
it can also go through the digestive tract there. right?
Oh, and then plug it up.
Across another-
That one is definitely not.
that's not the ideal one.
Yeah.
Even the gastric band is not really.
Does anybody, do you know anybody that's had gastric
I do.
bypass?
Yeah, I know people that have had the sleeve and the gastric bypass. The sleeve is definitely way less successful than the Ruin-X or Ruin-Y or whatever. The gastric sleeve, it seems like very easy to just reverse on your own.
Yeah.
Yeah, and I know people that have actually gotten it a couple times.
Really?
Oh,
gastric
wow.
Yeah.
Okay, that's,
Yeah.
jeez.
If you got the money,
Hit
you can do it.
But the two people that I know that have the Ruin-Y, they're very successful.
Uh-huh.
Really, yeah. And they don't have any major health problems as far as I know.
And I imagine that you do get a little stretching of that pouch that's left behind.
I do know one person that has gone back to their regular weight that had the Ruin-Y
Really?
too. Yeah.
Wow. Since eating a lot of fatty foods. Good job. Oh, sorry. Go ahead.
I'm just gonna gastric bypass last month.
This year, your mom just had a gastric bypass?
Yeah, last month.
And she's doing well?
Yeah, kind of.
Do you know which, do you know which one she had?
Like this one?
Yeah, that one.
Okay.
The second one.
Which
The
one?
most
The second
common one.
The
Yeah,
Ruin-
Ruin-Y.
the Ruin-Y.
Yeah.
Seems to me like that would be the most,
Extreme one.
yeah, it's the most extreme, but it also also the one that you would
Most
have the
effective.
best chances of
Yeah.
not
Yeah.
going, ending up
Yeah.
back in the same
That's
position
like
as you were.
she's like only on like she's only allowed to eat protein shakes right now still.
For a month.
Yeah.
Protein shakes.
Does she have a hard time keeping it down?
Kind of. She just gets like nauseous every single time she
Yeah.
eats anything.
Oh, cause it's
Yeah.
such a tiny space.
Yeah.
That's what happened to the
Yeah.
people I know too.
Huh.
Like always having, like I remember specifically having to pull off to the side of the road so they could, yeah.
They had to get rid of what they had. Oh, bummer.
Can she even finish her protein shake? Like, does she finish it or does she?
She
Cause
finishes it in like 2 hours. Like she has to
Okay.
take 6 every like,
yeah,
Oh,
and
Yeah.
even like with water too, like she can only take a little sip.
yeah.
that's harsh.
Yeah.
Yeah. Well, word to the wise, right?
Yeah.
Eat well, exercise. Don't do that. Thank you.